Good afternoon. Again, this is Dr. Charles Foster with Fostering Wellness, and I want to welcome you to yet another of our month-long video series where we are honoring the founding of chiropractic. Recall that is coming up September 18th, and it was 121 years ago. And today, the topic that I want to address is what do chiropractors treat? Dr. Taryn addressed yesterday a little bit. She kind of touched on it when someone had asked, can chiropractors treat bursitis? And so she was able in her brief couple minutes to talk about that. So I want to just tell you what we do treat. Very simply, and I won't speak for all chiropractors everywhere because there are some differences in how chiropractors look at their job. But I can speak for Fostering Wellness and a very large number of chiropractic offices across the United States, across the world, in fact. What we treat is something called subluxation, or properly, we call it vertebral subluxation. Some people call it vertebral subluxation complex. And they refer to the complex because it really has 5 component parts for some of those who look at it that way. One is the muscular component, because when a bone is out of alignment, it causes stress on muscles. There's the neurological component, because when the vertebral column is out of alignment, it puts some pressure either on the cord or on one of the spinal nerve roots. And it doesn't take very much pressure. It really takes about the weight of a dime. It's a very small amount of pressure that can cause excitation of the nervous system or inhibition. But either way, as Dr. Taryn had talked about, it makes it so the nervous system is not functioning at its optimal level. And when the nervous system is not functioning at its optimal level, then the body can't function at its optimal level. And when that happens, the body's immune system goes down, the body's respiratory system can be affected, the body's reproductive or elimination system can be affected. So we have the muscle component that I mentioned and the neurological component. But there's also what happens at the cellular level, particularly around the spine, at the discs. When the spine is not functioning properly, tissues get inflamed, and that inflammation actually causes degeneration of tissues. That can be looked at, that can be observed on x-ray, it can be observed in cadavers, it can be observed in live tissue. Another thing that can happen is the abnormal motion. Obviously, when a bone can't move properly, it doesn't, or when it's out of alignment, it can't move properly. It's like the front end of your car. If it's not properly lined up, the car doesn't handle as well, it doesn't turn as well. And so we have the motion component. And then we also have, I'm just checking my note to make sure I don't leave anything out, what happens when the spine is deteriorating over a long period of time. And when that happens, we begin to get joint degeneration. So the tissue changes in such a fashion and to such a degree that it actually looks like arthritis. So we've addressed what a subluxation is. It's a number of those things. And to the degree that subluxation is causing a person's health problem, then reducing that subluxation may improve the health problem. So I hope that helps you. As I said, not every chiropractic office looks at it the same way, but that's how we look at it. And if you'd like to find out more about that, please give us a call. And we would be happy to talk to you in detail. So looking forward to seeing you again next time. Either Dr. Taryn or Dr. Renee will be bringing the next short video clip to see you. Hashtag Founders Day, Discover Chiropractic, and Fostering Wellness.